Good evening, everyone. It's such a pleasure to welcome you to our webinar. We're going to be talking about recommendations for specialists practicing ultrasound independently of radiology departments. This is a joint RCR and BMIS collaboration, but gosh, the input from BMIS has been phenomenal. So I really hope you enjoy listening to colleagues and later in the webinar, making any points or questions you'd like to from the audience. Just two little managerial things. The first one is that we're going to record the webinar, but only up to the Q&A. So the recording will be available to listen to afterwards. But when you're asking your questions and when we're answering them, that won't be in the recording. So please don't feel inhibited by that. The second thing is that we'd like you to put your questions in the chat, please. We'll all be watching out for the chat. And when we go to the Q&A, we'll bring the questions on from there. So leave them in the chat and we'll try and make sure we pick them up. Could I have the next slide, please? So I'm going to introduce the team tonight and then the team are going to take it away. My name's William Ramsden. I'm the Vice President for the Clinical Radiology Faculty at the Royal College, and I'm a paediatric radiologist in Leeds, so I have a lot of interest in ultrasound myself. The presenters tonight are Professor Adrian Lim from Imperial, Hazel Edwards, who's the BMIS Professional Officer, and Prashant Verma, who's also from BMIS, the chair of their Physics and Safety Group. The panel's a bit larger than the speakers, and it's a real pleasure to mention that Professor Paul Sidhu, Dr. Alban Killingbeck, and Dr. Tom Lister are also here, and we'll all be trying to take your questions at the end and hopefully give you some good answers. So without further ado, I'm going to hand you on to Adrian and his colleagues, and enjoy the listen, and we'll look forward to your questions afterwards. Thank you.
Thank you very much, William, and welcome to everybody. Just wanted to start off by giving you a little background of how these recommendations came about. And as you all know, these sort of guidelines, when they take a long while to be written, so it's at least been 2, if not 3 years in the writing, going around through several rounds of drafting. And how it came about was that there are 2 earlier RCR documents, these 2 specifically, based on recommendations for medical and surgical specialties using ultrasound, and another looking at training standards and also an intervention. And our group was asked to look at updating these recommendations itself, which was written at that time quite in detail about what knowledge was required to be practicing ultrasound. But as we know, since then, ultrasound has changed a little bit in terms of who uses ultrasound over the number of years. When those articles were written, most of ultrasound services were provided by sonographers and radiologists, and there were some people working outside the radiology department who were wanting to use ultrasound. But since then, and it's a good thing for ultrasound, that it's been very useful in all the other specialties who are wanting to take up ultrasound, ranging from emergency physicians to physiotherapists to podiatrists and now even GPs and practitioners working in remote locations. So the first thing we did to look at updating these guidelines was to turn to the point of care ultrasound group. So the groups that are not radiologists or sonographers who are working with ultrasound, predominantly within the BMIS Society. And we had multiple consultations, and our groups within BMIS consists of physicians, emergency medicine specialists, cardiologists, intensivists, some clinical scientists, and physiotherapists as well. So quite a broad spectrum of specialties. And what we felt from the group that came about on the multiple meetings was that these guidelines, it was not essential to be too prescriptive, because it was quite difficult to encompass the curriculum and knowledge that is required by all ultrasound users, because some specialties may require different requirements in what they need to know, what they want to get out of the ultrasound examination itself. And what should be achieved from these guidelines are standards that all users should be able to meet, or at least work towards and try and achieve in the end. what we quickly came to realize, instead of just updating, for example, what is required when you want to scan a kidney, what you need to know and what the pathology, all the pathology that you need to know is, we thought that that sort of curriculum detail is best left to the individuals of their varying specialty, because it's so wide and diverse now that it would be impossible to have a document that encompasses all specialties currently. And thus, the remit of the curriculum should be devolved to the individual and their respective specialty field and their governing body and educational society or college to look to see what is required for their particular specialty. But what this document does address is that there are certain bits of ultrasound knowledge and physics and safety which should be common to all practitioners of ultrasound who want to use it clinically and diagnostically, and also the terms of governance of the safety and equipment that's going to be used, which will be covered later on in our talk. So really just to let you know that this is derived by a lot of consultation, a lot of meetings, not just by the main contributing authors on the left-hand side of the screen to this whole document, but we're also grateful to all the POCUS members, the professional standards group within BMIS and the RCR, because multiple iterations of this document have been going back and forth, and you can believe how many iterations there have been before finally actually going out to all the wider members of the RCR and BMIS for their comments, and we've taken everything onto board. And then finally, actually going back to the stakeholders and other endorsing organizations, such as the Society of Radiologists and the Chartered Society of Physiotherapists and the British Society of Rheumatologists, as well as some other organizations to look at endorsing and for their support for this document. So a big piece of work and hopefully with a lot of value and providing valuable guidelines. So that's just the background of how it came about. And I'm just going to hand over now to my colleague, Dr. Prashant Verma, who is a clinical physicist who wrote the main author on the section of governance of ultrasound equipment and safety. Thank you, Prashant.
Thank you, Adrian. That's a really comprehensive introduction. And just to add to that, one of the reasons why we felt this guidance, these recommendations would be really important is because of obviously over the last few years, the type of ultrasound scanners that are now available to people have really proliferated. You get all the traditional types of scanner, but now added to that, we have these handheld scanners that are available on the market, and they pose a real question about how do you provide governance in the healthcare environment. And so in order to do that, we put together some recommendations, and if Adrian could just move on the slide, that would be great. Okay, so I'm just going to talk a bit about the framework for the governance that we've put together in this document. And so if we go to the first bullet point, please. So we feel it's very important to establish a group to oversee the trial of the equipment, because as I said, there's a wide variety. So it is actually very important to choose the right type of equipment, whether you want a handheld ultrasound scanner that's operated by a tablet, etc., or you want something that's a little less portable, but still not quite your traditional cart-based system. So it's important to have that group. And once you have that group and they've gone through the trial, the purchase, the maintenance, repair sometimes of the equipment, and then finally the decontamination, that group will look at things like having a set of users that have training records attached to them, and one person who basically will oversee that. So you have an authorized user or a lead clinician that will basically look after the governance of the scanner during its lifetime. So an important aspect of that is to have some type of standard operating procedures for the different types of scan that scanner may be used for. And included in that, it's very important, is to have the correct clinical presets for the application that the scanner is going to be used for. So if you could move on to the next slide. And of course, one of the things that we recommend in these guidelines is to avoid using personal mobiles or tablets if you connect them to handheld devices. If you do need to use that type of a system, it's probably best to have something that is purchased by the trust. And so it remains with the trust after, say, you move on or you hand over your own personal mobile to someone else. So you want to avoid situations like that. So if you could move on to the next slide. And the first bullet point, please. And I've sort of already mentioned this, and that's to do with national data security and patient data security in particular. And the guidelines point out various recommendations and some regulations that are there that trusts should adhere to. There is also the National Centre for Security, which is a very useful website, actually, and it has information on how to desanitize data once you want to move your scanner or your on when you decommission it. Next bullet, please. So that's the governance framework in terms of purchase and who should be allowed to use the equipment and what sort of parameters they should set when they're doing a scan. But there is also the actual equipment, and is it fit for purpose, and does it remain fit for purpose? And the reason this is very important for POCUS equipment is because a lot of people may end up using it. The equipment is inherently very portable, so it will get moved around, and its ability to perform can vary with time, probably more than a cart-based system that's just sitting in one room for its whole lifetime. So in order to have a grip of that, it's good to have a governance approach that includes acceptance testing, some periodic assessment of image quality, and finally, in terms of POCUS, because there is a wide number of users, they should have some training in how these scanners work. So especially POCUS scanners, because they cover a wide variety from cart-based to handheld, and some of them incorporate the newest technologies. It's important to understand what technology they have and what role it plays. So some of these systems will not have time gain compensation. They'll have different ways of using Doppler, and they'll have different constraints for the use of Doppler, for example. So, for example, some handheld devices will say they have color Doppler, but it will be very limited, and the user should be aware of how much information they can gain from the images and the information that's provided. Some of the very new scanners don't even have a focus, which is something very traditional for ultrasound. So it's important for the user to understand what that means and how that image is formed if there is no focus. And of course, one of the big things now that's very important is the use of artificial intelligence or machine learning within the actual equipment. And that happens in the background. You see an image, but you don't know exactly what the process is to form that image, and that image will inform you. So you have to understand what the artificial intelligence is capable of and what it isn't capable of. And finally, the point I've made the point there about safety guidelines, and this is important because, for example, you could be a clinician in the emergency department and you pick up a normal scanner and you end up, say, having to scan someone's eye. Now, the guidance and the regulations for scanning someone's eye are very different in terms of safety limits on the output power of an ultrasound scanner than they are for general scanning. And, I know this through experience, is that the scanner, unless it's specifically been set up to have a preset for scanning the eye, the chances are if you pick up a normal probe and do it, you will be overexposing that patient's eye, for example. So it is very important to understand that there are safety guidelines that apply, and the document has an appendix. I think both the appendix touch upon this, and they basically have got the BEMAS guidelines on safe scanning in there. So that's just to provide some idea of what the governance of the equipment, what that framework should look like. So thank you.
Oh, thank you, Prashant. Just to say, for your input and expertise on this subject and for these guidelines have been invaluable. So thank you and your team. Thank you very, very much. Next, we're going to have Mrs. Hazel Edwards to speak to us about, Hazel wrote a lot of the section on the governance and the use of ultrasound scan. I'm going to stop sharing my screen. So over to you, Hazel. Thank you.
Thank you very much, Adrian. I'm going to try, oh, thank you, Prashant, as well. I'm going to try and bring up my slides. Okay. So could we have the first slide then, stating governance of equipment? Because I just want to finish off from what Prashant was saying about hygiene with the equipment. Can you see that slide, please?
Yep. Let me just. There we go. Is this correct, Hazel?
So if you can move on to the next slide, please, Adrian, as well.
Yep. Here we go.
There's two things that I just want to mention about hygiene. Hopefully you can see those two bullet points. And that is that when you buy your equipment, it's important to double check with the manufacturers exactly what wipes and things should be used on the machine, rather than just guessing or using any old alcohol wipes, because they could potentially damage the surface of the probe, and that in turn can then negate your warranty. So do double check with the manufacturer or in their instructions. And the other thing I wanted to mention about hygiene, which is very important for all ultrasound users, is that they need to adhere to the new guidance from the UK Health Security Agency. They launched guidance in 2021 on which type of gel to use on which type of person, and then they updated it with some minor amendments in May 2022. And the information is in our new guidance document that we're talking about tonight, and it just explains when to use sterile gel and when to use gel from a tub or a tube, non-sterile. Can we have the next slide, please? So now, hopefully you can see I'm going to talk about governance of the user, the ultrasound practitioner themselves. And with this section, I'm going to talk about briefly education and training, continuing professional development and audit. And I'll also end my bit with just mentioning the importance of radiology departments and POCUS users coming together for the good of the patient community. And again, these links are in the guidance. Next slide, please. So when it comes to education, we recognised as a group of authors that many POCUS users out there have already very well established courses of their own. They're well respected, they have solid curricula, and they're fit for purpose. And the ones I'm talking about are from organisations like the Royal College of Emergency Medicine, their core ultrasound course, focused acute medicine ultrasound, the famous course, and focused ultrasound in intensive care, the FUSIC course. And again, these are well respected. They train their practitioners in the skills that they need to do their job within their scope of practice. But that's not the same for all POCUS users. Some don't have anywhere to go. And so what we recommend in the first instance is to contact their either their senior colleague or their professional organisation and ask what's out there, because there may be courses that are appropriate for them that they don't know about. If that doesn't help, then they can also try contacting CASE, the Consortium for the Accreditation of Sonographic Education. And BEMAS is one of the member organisations that oversee the work of CASE. And this organisation accredits all kinds of courses in UK universities, not just long postgraduate courses leading to master's degrees. CASE also accredits short courses. And if you have a look through the CASE directory, which I can either provide you with, or you can have a look on the CASE website, you might be able to find a course that's appropriate for you. But certainly in this guidance, as Adrian said, we're not writing full curricula for everyone. It's impossible, and it's also not needed. Can we have the next slide, please? And when it comes to the education programs that POCUS users access, we can't stress enough that it's essential that all of them contain a physics and instrumentation or a physics and knobology element, because the practitioners need to know how to drive their machines to the best of their ability and to get the best images. All education must have an element of safety as well. Again, you can't talk about safety too much, and practitioners need to be mindful of the acoustic output from their equipment and what it may or may not be doing to human tissue as they scan. And these 3 simple photographs are taken by me on a piece of equipment I used, and it was very easy for me to go from having a very safe thermal index level, the TI in bone there, which has got the kind of green traffic light around it. It was very easy to go from 0.3 to a whopping 2.6 in the red zone there, just by pressing 2 buttons. And that could have serious safety implications. Any education program also need to cover ultrasound appearances of tissues, so it will need to go in depth on normal appearances, normal variants that can catch us out, equivocal appearances, and abnormal appearances, so that the POCUS practitioner has some attempt at decent interpretation of what they're looking at. Communication is also vital, not just for communicating effectively with the patient you're scanning, but also in constructing an appropriate report ready for onward referral if that patient needs it. And BEMIS has got this all wrapped up for you in a way, because in 2021 we developed a POCUS report template that is free to download from our website, that practitioners can either use as it is, or they might want to modify it and make it more fit for purpose depending on the area they work in. Can I have the next slide, please? Regarding education, another important element that we recommend all POCUS users have is supervision. This need not be someone perched on your shoulder 24/7. It could be remote supervision, it could be indirect. Luckily, we're living in a more flexible world now where you can send images to people for advice, or you can retrospectively review what you've done. But nevertheless, supervision is a vital part of picking up ultrasound. And this supervisor needs to be able to produce progress reports and action plans for the trainee so that they have a direction to go in and they know that they're going in the right direction. And the education should also end with some kind of assessment of competency done either by the supervisor or by a recognised agreed assessor. Once the practitioner has passed that assessment, the education doesn't stop there either, because they'll still need support and mentoring after sign off, a bit like when you first pass your driving test. And the POCUS practitioner also needs to maintain and hopefully improve their competence as the months and years go on. And they'll do this via a mix of continuing professional development and audit. Next slide, please. So what counts as continuing professional development? Again, we've gone into this in some detail in the document because we want to emphasise that it's not all about expensive, long-winded postgraduate courses that you sign up for. It's not even about expensive study days. There's tons of good CPD out there that's completely free. And it could be reading useful guidance like the safe use of ultrasound clinical guidelines there. It could be other guidelines from the Royal Colleges. It could be reading an article in the fabulous ultrasound journal there. It could also be writing an article for an ultrasound journal or clinical radiology. That's also a fabulous type of CPD. You can discuss interesting cases with colleagues, share ultrasound images. And there's also the lovely NHS England free resource, e-learning for healthcare. And this is free to all people only in the NHS though, or studying on a university course. But if you do have an NHS email address, you can access this material. And the lovely thing is there's lots of ultrasound sessions on it that have been produced by me and the College of Radiographers. There's also sessions produced by the Royal College of Radiologists, by RChem, Famous, Fusic, Ice Blue, the lung sessions. So you name it, and you can find your ultrasound sessions on e-learning for health. And the lovely thing is too, you can do it when you want, where you want. Next slide, please. Also, shadowing another practitioner counts as excellent CPD, or you might contact your manufacturer of your equipment or your application specialist and ask for more information on your equipment or some new software that you might want to get to grips with. Watching a webinar is useful CPD. And of course, reflecting on patient feedback, whether it's positive or negative. The emphasis with CPD is not so much on collecting points or hours of study, but it's about keeping a simple record, and most importantly, some kind of analysis of how each event has impacted on your practice, how it's made you change, how it's made you better. Next slide, please. It's important that all POCUS users participate in audit, and this can either be self-audit or peer review if you have a network of like-minded POCUS users. And you review images and the report together, and you use a simple gap analysis, good, acceptable, poor. But it's important to stress that you can't just review images in isolation, because you wouldn't be able to tell the quality of the exam just from the images. You've got to know the circumstances under which the examination was conducted. Audit is regular and ongoing. It's not just a one-off. And again, Beamers can help you with that, because we have an audit tool. You can see half the sheet there on the screen, and it's even accompanied by explanatory notes. And again, you can download this from our website. There's also audit advice on the RCR, and plenty of general healthcare audit advice out there if you just Google it. Next slide, please. So finally, I just want to talk about the importance of connecting with imaging specialists, and by that I mean sonographers like me and radiologists like Adrian in radiology departments. We know very well that POCUS is here to stay, and we're glad about it. As Adrian said, it's transformed many aspects of patient care. We know too that all clinicians are under pressure at the moment, time pressures, and that applies equally to radiologists and sonographers, as well as all the POCUS users out there. But it doesn't mean that we should stifle innovation and service development. We still need to find time to collaborate and enjoy those mutual benefits. And certainly POCUS users may reduce referrals to radiology and ultrasound departments, and there is growing evidence that that is happening now. And they may also speed up patient care, get them on the right pathway quicker, because they don't have to wait for a radiology appointment. But in return, POCUS users may need help with image storage, with image interpretation, and with their educational needs. Next slide, please. So the summary points I have here are just for, we want to stress that knowledge of basic ultrasound safety, physics and instrumentation is absolutely required by all users of ultrasound. And the ultrasound machines that they buy must be fit for purpose and meet recommended standards. And the safe storage of ultrasound images with the appropriate accompanying report is essential for continuity of patient care. And it's the individual operator who must take responsibility for acquiring the appropriate clinical and sonographic knowledge that they need that's relevant to their specialist field and their level of practice too. And it's the operator's responsibility also to participate in regular audit and continuing professional development. So last slide, please. So in conclusion, these generic standards that we've developed, we believe are appropriate for all POCUS users. We feel that they help maintain safety for both the user themselves and for the patient. And we believe that good collaboration between imaging specialists and the POCUS community will help to improve continued quality and keep the patient at the centre of what we do, which ultimately is what we all want. So last slide and time for questions.
Thanks so much, Hazel, and thank you, Adrian and Prashant, for contributing as well.